I'm so glad that I'm so glad that I have you here again. And like we said in the last video, that we're going to be talking more often just to couples and just people in general.
Okay.
And you and I talked this morning and came up with a topic that I think is relevant and very important. And it's health and taking care of yourself and just maybe different obstacles that people have faced in marriage. So I just want to spend time today just kind of focusing on you and your story. So there is a testimony that you have that happened like years ago. And do you want to share with people about, what that is?
Sure. So I think it was about 2004. Had a serious case of pneumonia. Spent 2 weeks in the hospital, sedated, and really, life-threatening. So wasn't a good time in my life, but thank God I got through it to still be here. And but definitely something I look back at as something that I could talk about, and hopefully, particularly in this time period with the pandemic, and some people are taking it not as serious, but anything dealing with lungs or anything that affects your lungs, or all the symptoms of or all the results of COVID, that's some serious stuff.
Yeah, I think what was scary for your situation and mine too, because I had to, kind of help you get better, and I really didn't know if it was going to be a situation where whether you lived or whether you died. And I just wanted, before we go too far with the story, I kind of want to show them, and I don't know, hopefully they can see that, but that's a picture of you in the hospital. I don't know if it was in a ventilator or a respirator. I'm not sure exactly what the correct term was, but you had to have something to help you breathe, to help you function. So let's talk about what that kind of felt like, as far as, I think we went on a trip together, right?
Yeah, we went to, I think it was North Carolina.
Mm-hmm.
So what I had was more of a viral pneumonia, meaning that, something virus-like attacked my body. And I don't know if my immune system was down or having issues at that time, but so it came and attacked my body. So it could have been really anybody, anytime. But yeah, so it was just a virus. That's what it started as. And I think more importantly for us is to understand that when I initially got sick, I was kind of being hard-headed. I was taking some medication, trying to self-medicate, because just like any other man, we don't like to go to the doctor until so I was taking medication, but I was also throwing it up, and so my body wasn't using medication, because each time I was taking it, I was just getting rid of it, and so that wasn't helping either. Once I got the virus, so my wife pushed me to go to the doctor, and that's when they diagnosed it as pneumonia. So
yeah, and it was scary because it kind of, first of all, it didn't affect me at all.
Right.
So that's why, it's kind of concerning sometimes the way a virus works, because it may affect someone and it may be detrimental, and then another person may not even get the virus and be totally okay. But I know that you were having a fever and it didn't break, and it was just some things that you were going through that you don't normally go through that. Now let's talk a little bit about what made it so unique to me is that you're a healthy person.
Yeah, so I'm an avid runner. So even during that time period, I was probably running 3 times a week. So I was probably still doing about maybe 24, 25 miles a week. So again, thank God that my health helped me to fight it once I got it. I think, because of course, if you're not healthy, then it could lead to other things happening. But I was healthy going into it. So again, we can't take. We may be doing all kinds of stuff as far as health-wise, but like that situation, and it still attacking the body, just as COVID will. Doesn't care how many bench presses you do or how many miles you run. still could attack your body.
Yeah. So that's, as far as a marriage, I think, why I want to talk about it as far as a marriage is because when you get into a covenant and you're like for better or for worse, what do people do when that worst comes?
Yeah.
And that was a really bad situation. That's like a situation where, we had young kids and it's like, okay, I have to still figure out how to be a mom and figure out how to take care of my husband and try to be there for the family who were concerned. So it's just a lot of different things that when people are looking in from the outside, they don't know what goes on when you face some of these challenges. So, I thought that we would come and just kind of talk to people because with COVID being here, some of us may feel like, oh, I don't want to wear my mask. It won't happen to me. And it might not. But then, what if it does? What if you do get it and you're in a situation where you end up in the hospital or your loved one has to figure out, how am I going to do? This person that I care about may not be here for me anymore. So it's deeper than just, I don't feel comfortable wearing a mask. It's more like, let's think about my health and the health of someone else.
Yeah.
Do you have any other thoughts?
I guess also think about, just from a spouse perspective, making those decisions. Again, you can't have one spouse just knowing about one piece of your family business. So you guys, spouses are to be making decisions together. If it's dealing with finances, paying bills, car notes, insurance, understanding insurance, understanding 401ks and all that stuff, because it may come to a time where you need to make a decision. So, and not have your spouse with you make that decision. And so that's why it's important for both people to have that knowledge, I think, about all aspects of your family business, or if you want to call it your family enterprise, whatever you want to call it. But you guys need to be both. Not, of course, you have people who are strong in different areas, but that other spouse needs to know something about the basic context of that area also.
Yeah, I agree. I mean, like you said, it's an enterprise. And within a marriage or within a family, you want to try to do things to make it, as peaceful within the family unit as you can. And you will be faced with different challenges. And that's why, I really wanted us to come and talk about just health and fitness, because that I think, well, not even I know that you're more into health and fitness than I am. So I think that if you prepare yourself in a way that your body is already strong, if something like COVID or something comes to you, hopefully your immune system will be able to fight that. So anything else? Like I said, that's a powerful testimony, and so grateful and thankful that God brought you through that.
Yeah. Let me say this too, even with the children, we talked about the spouse, but when your children get a certain age too, they need to be part of those decisions also. As they get older, of course, but our kids are in college, and so now start introducing them to certain aspects of our Boeing enterprise or our family businesses. So that's important too. Just want to bring that up. Okay.
Yeah, I mean, it's. I think when we come to the audience, we want to try to give them little nuggets so that they can thrive. We want to see families, we want to see marriages do well, and so that's why I think it's important for us to do this.
Yeah.
If you don't share your testimony, then people don't know what's going on. It looks like, everyone's smiling and acting like everything is perfect, but there are some serious things that go on within marriages, within families. So, let me ask you this. How do you feel as far as COVID and what's going on in your health? Are you doing things to kind of take care of yourself, or what does that look like for you?
I am, as best as I can, following all the guidelines as best as I can. I work from home, so that's a little easier. But just like any other normal human, this isolation is a little tough. So I've been going out a little bit, which, it's a little risky, but, I don't let too much fear play into my day-to-day life, as long as I follow the guidelines. And of course, there are some people who aren't. So I just stay away from it. You know, so the worst thing I want to do is, of course, you know, bring something home to my family. But I do go out, but not as much. And you know, again, it's just to get some fresh air a little bit, just to get out the house. But I think as long as I follow the certain guidelines, stay away from people as much as I can, then I think I'm okay.
Okay. And we've been talking for like 10 minutes, so I just want to quickly talk about, from your perspective, how do you think I've been handling COVID? Would you say I've been out a lot? Would you say?
Yeah, my wife she hasn't been out, period. So, and that's okay. You know, it has to be based on her comfort level. And you know, if you want to stay in, or if you want to go out, but she's been going to work, and so she's been learning to also just loosen up a little bit too. You know. Yeah,
there are certain situations where you cannot necessarily escape things. You know, we have to provide for our family, which means, you know, some of us are going to have to go back to the workforce. So as far as me, you know, I just feel like it's important for me to wear my mask, you know, wash my hands, social distance as much as I can. And just kind of right now, I'm still in a point where I kind of prefer to isolate as much as I can. Not that I don't want to be a people person, but I know the experiences of what a virus can do. So I'm just trying to be proactive.
Yeah.
So, and what you said was great as far as not having fear, you know, because it can be scary.
Yeah.
You know, and I know maybe I don't balance that as much. You know, maybe some of it is fear because I have seen what you went through. You were the one going through it, but I was the one on the outside, you know, kind of trying to pull you through it. And not me, but focusing on God and what God, his plan for you. That was scary to me because it was just kind of like, I don't know what God's will is for your life. You know, so it was just a scary situation to say, is this it? You know, is this going to be the end of what we have? To me, that's so special and powerful. So, you know, I think that's the point of me trying to talk about this topic today. Just wanting people to know how important it is to take care of yourself, to take care of the temple that God gave you, and just be aware of other people around you, you know, because something may affect you in a way differently than it might affect someone else.
Yeah, and I guess also, just last little tip is don't allow people that you see out there to normalize this whole situation, because it's not normal. You know, is it tough? Yeah, but it's for a short period. You know, God has a better plan for us, but for right now, you know, this is what it is. But don't normalize it, because this is serious.
Yeah.
You do not want. You've read stories, and COVID is tough. You definitely don't want to catch that beast. So.
And to me, it's not comfortable for anybody.
Yeah.
No one wants to adjust their life and say, okay, let me walk around all day with a mask. And I was telling you the other day, I said, one of the things that I enjoy doing is being able to smile, you know, so wearing a mask prevents me from doing one of the things that I think that kind of makes me special or stand out.
Yeah.
But right now, it's, you know, the health situation is more important to me than my comfort level.
Smiling.
Yeah. So, okay. But yeah, but as always, I'm glad that we're able to do this. And is there any like last things that you want to say?
No, just, again, this state, you know, COVID's still here, so don't normalize it. Take care of yourself and your family if you do have to go out. It's not about you if you have a family, so consider your siblings and your spouse and everything else.
Yeah, I think that's great advice. So we'll be back again soon.